those long trips.
Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
1 in 8 women are affected by infertility, and during the holidays, many people feel distraught or disappointed that they can't start or grow their families. But infertility can be evaluated easily by a board-certified reproductive endocrinologist, which can help find the causes with some simple and minimally invasive tests. Dr. Erika Johnston joins us right now from HCA Henrico Doctors Hospital. Thanks for being with us.
My pleasure. Thanks for having us.
And we were talking before we got started. The holidays really do kind of make people feel a little more pressure, don't they?
You're exactly right. And I think it really brings out some of the frustration and anxiety that we see in our patients, and perhaps even heightens their resistance to engaging in care and evaluation. So I'm here today to share with them that in 4 simple, easy tests through our offices, we can help to identify some of the challenges that they're having in trying to start or grow their families.
Okay, let's talk about those easy tests, because it's good to hear that it's not going to be a terrible process.
That's right, not terrible at all. So the first thing that we usually start with is very simply looking at blood draw. And what we're looking for there is trying to understand a woman's egg count or her egg reserve. That can be done with 2 simple blood tests. And what we're trying to understand is, compared to her chronologic age, does her egg reserve look similarly favorable, or is it concerning in being too low or even too high?
Okay. And then people might worry about the cost of doing this and, of course, treatment. So let's talk a little bit about that.
Sure. So good news is that a lot of our diagnostic testing, including 3 other evaluations, is typically covered by most major health insurances. And we'll often investigate those insurance coverage for our patients to try and maximize the coverage that they have through their benefit.
Okay.
Oftentimes we also do an ultrasound in the office, and what we're looking there for is actually structure. So actually looking at the ovaries, looking at their pelvis, looking at the uterus to determine if there are any benign growths or even a benign cyst that can be creating a blockage for the egg or sperm to transport through.
Okay, and then what are the other couple of tests?
Yeah, great question. So probably everyone's least favorite thing to discuss, but it's a semen analysis. So in our patients that have male partners, we actually try to look at the count of the sperm, the movement of the sperm, and the shape of the sperm to determine if it can cause a pregnancy. Finally, we do an X-ray of the patient's uterus to determine if there's a blockage in the tube that could be inhibiting their success in trying to start their family.
Okay. And then a lot of people also might be concerned, oh, if I'm going to have to use in vitro fertilization, that's very expensive. But a lot of families actually can find other solutions before you even have to get to that level.
Precisely. And I've really enjoyed helping people grow their families through in vitro fertilization. We have a lot of fabulous opportunities for advanced reproductive technologies, but the reality is that less than 50% of patients are going to need those services. So most couples can actually conceive with low-tech solutions. So through Shady Grove Fertility Richmond on the HCA campus, we really feel like we're offering innovative, thoughtful, stepwise care to try and maximize low-tech solutions for these couples.
Okay, Dr. Johnston, thanks so much for filling us in. We appreciate it.
My pleasure.
And
Thank you.
happy holidays.
Happy holidays to you as well. Thank you.
And let's get you updated on our forecast. Nick.